The COVID-19 pandemic has forced a lot of businesses and services to rethink how they serve people, and that includes our healthcare system, specifically in rural areas. For more on this, I'm joined by Saskatoon pharmacist Amy Morris. Amy, thanks for being here.
Thanks for having me.
Now, we know there have been many struggles through the pandemic. How have you seen things improve in healthcare specifically?
Yeah, definitely the pandemic's been tough on everyone working in healthcare, both COVID related and non-COVID related. But I think what gets me really excited about the future of healthcare in this province is really some of the innovation that's occurred during the pandemic. We've kind of seen this widespread adoption of virtual healthcare. And so that's kind of what I'm looking forward to seeing what happens next.
In rural areas, there may not be the same level of tech infrastructure as we have in bigger cities. Do you think that's something we should also be considering an essential part of healthcare?
Oh, for sure. If you go into a number of rural or remote areas in Saskatchewan, you know that the internet access, the cell phone access isn't as reliable. Sometimes in smaller centers, you can't really get a reliable internet connection. So that makes it difficult when we focus our virtual healthcare options purely on app-based or web-based products that really are meant to be on your personal device.
You grew up in rural Saskatchewan. How would your life have been different as a kid with your family if virtual healthcare was an option?
Wow, I talked to my mom about this quite a bit because she's still, her and my dad still live in southwestern Saskatchewan. And really, my mom made a comment just about how much easier it would have been if she wouldn't have had to load up all the kids in the minivan and drive an hour one way to see a family doctor. So if you think about that, that's a huge burden for a young mom to bear, or someone that's elderly, or perhaps someone that doesn't have access to a personal vehicle. That's a really big burden. So if you can see a clinician, any type of clinician, within your home, that relieves a lot of pressure and time that you can either spend at work or spend with your family.
In an opinion piece you've written for CBC, you say that virtual care should never completely replace in-person clinical visits, but it can support existing care. When this is over, and it will be someday, how do you see healthcare evolving?
Yeah, that's an important point, I think, Sam, because virtual healthcare should never replace that patient-clinician relationship. We know that relationship, if it's strong, will actually lead to improved health outcomes in patients. So we can't replace that. Virtual healthcare is really meant to supplement that. So let's say you already have an existing relationship with a clinician, and during the pandemic, that clinician's now able to video chat or phone chat with you about different concerns that might not require an in-person visit. That's when I think virtual healthcare really shines.
Amy, thanks so much for your time.
Thanks for having me.